Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us once again here on Health Professional Radio. In this segment, we're going to be speaking with Dr. Lora Shahine. She's joining us here from the University of Washington to discuss how remote work has made navigating the logistics of fertility more convenient for people on their paths to parenthood, but a bit more isolating as well. Welcome to Health Professional Radio, Dr. Lora Shahine. Thank you for joining us this morning.
Thank you so much for having me, Neil. I'm excited to be here.
Well, tell us a bit about yourself and your current role at the University of Washington.
Absolutely. So I'm a reproductive endocrinologist. A lot of people call that a fertility specialist. And I have a clinical faculty appointment at the University of Washington, which I love because it helps me do teaching and continue research. But my primary practice is at Pacific Northwest Fertility, which is a private practice here in Seattle, helping people build their families.
How prevalent is infertility?
So much more common than I think people realize. It impacts 1 in 8 couples that are trying to conceive. And that can be even more common in certain populations. Like as we age, it can be more common. It's 1 in 4 physicians, which I think is pretty amazing. If you have not struggled to build your family, I bet you know someone, even if you don't really know someone or they haven't talked to you about it. It's so common.
Does it affect women, men? Is it kind of an equal thing?
Yeah, that's a great question. It definitely, our society has a bias towards assuming that anything family building, has to do with women, but male factor infertility is a huge piece of fertility, and it can impact couples at least 30 to 50% of the time. And sometimes it's a part of the whole picture, not just isolated to, low sperm count or isolated to, a fertility issue. So it really is often a big part of the process.
Are there any other misconceptions surrounding infertility that can be cleared up for us here today?
Oh my gosh, how long do we have to talk? Oh, there's so many misconceptions. I think you've hit on two big ones, that it's not common, because that's certainly what we're taught in health class or in, the movies, that it's unusual for people to have infertility. You hit on another one, that it's always the, female partner's fault. And it's often a male factor, at least partially involved. I think another thing that people don't think about is just how common miscarriage is. October happens to be Infant and Pregnancy Loss Awareness Month, and so it seems like a great opportunity to remind people that 1 in 4 clinically recognized pregnancies end in miscarriage, and that's another part of family building and struggling to build your family that a lot of people experience but don't talk about.
So just to be clear, infertility doesn't just mean the inability to conceive. It also means an ability to conceive, but having consistent miscarriages.
Exactly. It's really the inability to have a baby after trying for 6 months to a year, whether it is not having a positive pregnancy test or having miscarriages and losses.
So when is the right time to seek the help of a professional such as yourself?
Anytime. People are really scared to come see a fertility doctor because I think there's a lot of assumptions, like we're going to, tell them to do IVF or something that they're really not ready for or comfortable with, or force them to do something that they don't want to do. But really, anytime you want to learn about, you're curious about your fertility, it's okay to meet a fertility specialist. And most of the time, people do not need a referral. I think that's a real assumption. I mean, definitely people should speak with their insurance provider, but it's usually not required. And but in general, 85% of people will conceive within the first year of trying. And so the recommendation is to definitely see someone if it's been 12 months of trying. But if someone is, especially the female partner with eggs, is 35 years or older, they should really seek help and evaluation after about 6 months, because you just don't want to, miss very valuable fertile time, not knowing that there's an issue to address. And then another caveat that I don't see people talk about is this is the assumption that people have regular cycles and that they're ovulating. And so if someone's not having regular, predictable menstrual cycles, they should see someone right away.
What are you hearing from patients about being afraid to come to see you? Are they trying their own methods? Are they trying to do their own research, maybe changing their diet, lifestyle, things of that nature before they just say, you know what, this just isn't working? Is that something that is common?
Yeah, I definitely am the second opinion after someone has sought questions with Dr. Google. And so I think that's one of the reasons why it's so important to have good educational information online. So I have a big social media presence and I try to educate on YouTube or my own podcast, but other really important resources can be, the online community Fertility Out Loud, or if someone is looking for an infertility provider or reproductive endocrinologist, they can find fertility house calls. Like, these are two wonderful resources on the internet that I hope that Dr. Google sends people to, because there's so much misinformation out there. You really need to be careful about where you're finding that education.
Well, speaking of these platforms, how has this explosion in remote work and contact affected infertility as far as finding specialists, as far as getting the help and advice that you need?
Yeah, I think it has impacted a lot. In the beginning, I think the media really focused on how a lot of clinics chose to pause fertility treatment for anywhere from a month to 2 months. Not saying that infertility is elective, but just saying, like, gosh, we need to figure out a way to treat people in a safe way in the middle of a pandemic. And that, shifting to telemedicine visits, deep in quarantine, sometimes I was the only person that people were talking to, outside of work. I think there's been good and bad. I think that going through fertility and miscarriages, you need your support and community more than ever. And so being isolated was extremely difficult for emotional well-being. And so finding support, is really important. But a benefit is with a lot of my patients who are able to work from home, and this is certainly not everyone, but just being in Seattle, we have a lot of patients in the tech field, and being able to work from home has given people the space and time to do fertility treatment that they might have been putting on hold, whether it's egg freezing to preserve fertility or do that IVF treatment that does require multiple visits within a couple of weeks. People have found a way to have a more flexible and hybrid work schedule. So it's been a balance of good and bad.
I heard you mention Fertility Out Loud a bit ago. What is Fertility Out Loud and fertility house calls? What do they offer, and how are you involved in these programs?
Absolutely. So I am just excited to be able to talk about these two options because, again, there's so much misinformation online. I want people to find good education, evidence-based support. And so Fertility Out Loud is a website and a community online with great fertility education and information. And then Fertility House Calls is a way for patients to find reproductive endocrinologists and board-certified fertility specialists in their area, or maybe even who can do telemedicine visits. It's helping with education and access to care, which is something that is extremely important.
Well, if you would, Doctor, give us a website where our listeners can learn more.
Absolutely. So fertilityoutloud.com is a wonderful educational resource, and you can find the fertility house calls, the link to connect with providers through that website.
Fertility Out Loud, all one word, .com, correct?
Yes, that's the one.
Dr. Shahine, I appreciate your time this morning. Thank you so much for giving us this information. Hopefully you'll return.
Oh, thank you so much, Neil. I really appreciated being here today.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Lora Shahine. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also listen in, download, and subscribe at Anchor, Spotify, and be sure to subscribe to our YouTube channel at youtube.com/Health Professional Radio.